And welcome back. Well, you or someone you love may be familiar with having an enlarged prostate. It's common in older men, but now there's a breakthrough treatment for men with the condition. To talk more about the UroLift system is Dr. Brian Butler and Dr. Douglas Dwyer of Urology Associates. Thanks for being here, gentlemen.
Thanks.
Important conversation for men to hear. And I think it's one that often they're a little nervous about talking about, or they don't know a lot about, or maybe a family member has started the conversation. So let's just kind of break down what it is. What is BPH? And what would you say, how would you describe an enlarged prostate as well? What are those?
So the prostate's a gland that sits at the base of the bladder. It's often described as a walnut or walnut size, but it really acts kind of like a donut at the base of the bladder. And men after the age of 50, through a combination of genetics and testosterone, the prostate starts to grow. And so the hole of the donut gets smaller and smaller. And so men have symptoms because they're trying to pass their urine through a smaller and smaller hole.
Which makes sense because and it's right by the bladder. So then is it more that they would have symptoms of pain or more frequent urination?
It's more frequent urination, urgency to urinate, slow force of stream, maybe stopping and starting their stream.
Okay. Can they feel it? You know, because I often think of, women's disorders. Oftentimes you can feel a lump in your breast or something like that. Would somebody be able to feel an enlarged prostate?
No, you won't feel it, and it's not visible. You'll have symptoms, and the symptoms will let you know that something's going on.
How else would the prostate affect maybe everyday average life?
Well, essentially it's a reproductive organ, so it's important in terms of reproduction.
Okay. So if somebody is having symptoms of the frequent urination, painful, the stops and starts, what's the issue if it's left untreated? Does this always lead to a cancer?
No, the two, enlargement and cancer are two separate processes that happen. And essentially it affects your activities of daily life. You might stop golfing, you might not go to movies or go to the church. We all know the guy that wants to sit on the end of the row, and that's really how it impacts it, but it impacts their wives too.
Okay.
Because it interferes with sleep. All men, not all men, but many men with prostate enlargement will have difficulty in terms of getting up at night. And so there's been some recent studies that try to document that impact. And almost 2/3 of women say that their spouses voiding patterns at night interfere with their sleep too. So
absolutely, because if you're moving around, you're waking up. Is 50 kind of the age that's sort of a signifier for prostate, or can this be at any age for men?
Well, generally it's after 50.
Okay.
The gland starts to grow. You have changes in hormonal and genetic expression that cause the gland to grow.
So if you're taking a medication, are there symptoms or problems with treating an enlarged prostate?
Medications have been around for about 25 years, and they work very well in plenty of patients, but they have a couple of impacts. One is side effects. Okay, you can get things like stuffy nose, or you can get dizziness, or mild changes in your blood pressure. You can have changes in sexual function related to the medications. And also, cost is a big issue over time. Patients, particularly elderly patients on fixed income, they can have trouble in terms of trying to decide what medications to take because these medications are costly over time.
Well, and it sounds like if those side effects are really affecting your quality of life, it's not always the route that you want to go. Let's bring you into the conversation, Dr. Dwyer, to talk about what UroLift is, because this is a procedure that I assume is not a medication.
Correct. UroLift is a minimally invasive procedure, and it represents an alternative to the more traditional procedures that have been done to open up that channel, that narrow channel that Brian was discussing. It allows us to use an outpatient procedure in the vast majority of cases that takes about 20 minutes. That, in a nutshell, we put some suture material with some clips on the end, inside and out, that opens up that channel.
Oh, wow.
And allows the urine to pass more freely.
So really holds it open. Is this a permanent procedure?
Yes, we have data out to 6 years that shows that it's a permanent procedure. Although the prostate is somewhat dynamic, it changes with time, and so some guys may need to have something else, even a repeat of the UroLift procedure someday.
Yeah.
But yeah, the durability seems to be very good.
What kind of recovery? You said it's an outpatient surgery, so when you're going home, do you have a lot of downtime?
Yeah, guys are usually interested in how much is this going to hurt, how
Right.
long is this going to take off of work, and It's been, I would say, for the vast majority of men, it's been very good. Usually the procedure itself may be 15 or 20 minutes, a little time to recover afterwards. We usually make sure guys urinate before they go home to make sure that that's not going to be an issue right away. And then some of the things that can happen after UroLift, sometimes you'll have a little discomfort with urination, sometimes some more frequency, sometimes some blood in the urine. So usually, I would say on average 2 to 3 days until the blood goes away, and then you can get back to doing your normal things.
That's a pretty quick recovery time, 2 to 3 days, to not then have the symptoms with the medication and such like that. You both have been designated as a UroLift Center of Excellence, and that designation, I can imagine, means that you know what you're doing, you're good at what you're doing, and people can come and trust you. How important is that designation to you guys?
Yeah, this was a novel approach to treating prostate enlargement. When UroLift came around, we were early to recognize that this is a really good idea.
Yeah.
The Center of Excellence program with UroLift is a nationwide program that recognizes urologists who have done extensive training, have worked with a lot of patients, and have tracked those patients for their results afterward. And I think it represents that we take good care of our patients using this treatment, and yeah, we're pretty pleased that that we were honored with this.
It's a big deal. So congratulations for that designation, and I'm sure a lot of people are interested. They can come and meet with you guys and have a consultation and talk about it, I know as well. So if you're interested in learning more about UroLift, contact Wisconsin Urology. The phone number is 262-509-9821, wisconsinurology.com for Dr. Dwyer and Dr. Butler, both, again, designated from the UroLift Center of Excellence as well in this procedure. Thanks so much for being here, guys.
Thank you.
Important conversation.
Well, it's nice to help people.
Absolutely.